Next is Rochelle, and she again has a long question here, great question, and it's really about bilateral total hip replacements. And I'll just go back a couple of steps. So bilateral joint replacement, period, means replacement of either both hips or both knees in the same surgical setting. Okay. Now, what factors should be considered before getting a bilateral joint replacement done? So there's a few. One is dependent on how bad the deformity, how bad the pain, how bad the mobility is on the side that's maybe a little bit better. If both sides are badly deformed and you think that you're going to have a difficult time rehabilitating with that native joint on the other side, that's one reason why a hip surgeon or a knee surgeon may recommend that you go ahead with both sides at the same time. Okay, so that's probably the most likely reason for a recommendation of a bilateral total hip replacement in your case, Rochelle. Now, things that you need to be cognizant of. In order to do a total hip replacement or a total knee replacement with both of them at the same time, you really do need to be in tip-top medical shape, because you essentially double your risk for perioperative or around the time of surgery complications for everything. Okay, so we really do want you to be in the best medical shape that you possibly can be. And if you do have a few medical comorbidities, it's most likely that your surgeon will not recommend or suggest bilateral joint replacements. Now, one thing that Rochelle asks is, should the surgeon do an anterior versus a posterior total hip replacement in the setting of a bilateral total hip? That's a great question, Rochelle. But really, something that I stuck to in a previous question that I answered, the most important thing is that you are comfortable with the surgeon that you're undergoing this sort of journey with. And whichever approach that they're the most comfortable with, that's the approach that you should go with. There's no improvement in outcomes, no improvement in recovery time, no improvement in rehab if you go with the anterior approach versus the posterior approach for the most part, aside from that very early 3 to 4 week postoperative period. Okay. Now, the other question that you had in there that was tucked in there, Rochelle, is whether or not would one approach more likely, or with bilateral hip replacements or knee replacements, would you be able to go home instead of rehab? And the answer is usually yes. I find that more and more with my bilateral patients, if you're healthy enough to undergo bilateral hip replacement or knee replacement, you're usually healthy enough to rehab very aggressively and actually get home instead of needing to go to a rehabilitation facility, which you think with doing both joints at the same time, it's a little bit counterintuitive, but usually medically those patients are much healthier and recover much more easily after a bilateral total joint replacement than some people do after a unilateral or a single joint replacement. So great questions, Rochelle, about bilateral. That's something that comes up quite often.